Coronavirus: How the Pandemic Could Play Out in 2021. Vaccines for COVID-19 are now being rolled out, but in some parts of the world, this good news has been tempered by new strains of the virus. Exactly how the pandemic will evolve has become more uncertain. Predicting exactly how things will play out is difficult, but there are some things we can forecast with a relative degree of confidence. The coronavirus can produce significant mutations, and further mutations can result in stricter restrictions on behavior which will last well into the new year, and we may need further restrictions to control the virus if it is indeed more infectious. Producing enough doses of the vaccine and immunizing people will take many months. To illustrate the size of the task, look at an average English GP who looks after nearly 2,100 people in each locale. Assuming a GP works 8 hours each day, needs 5 minutes to vaccinate someone, and each patient needs 2 shots, it would take them more than 6 weeks to see all their patients. And that's before considering the other work the GPs need to do. Additionally, the 2 doses of the Pfizer vaccine need to be given 21 days apart, with full immunity arriving 7 days after the second jab. Other vaccines, such as AstraZeneca's, require even longer period between doses. It will take at least a month, if not more, to see the full effect in each vaccinated person. After people have had COVID-19 or received a vaccine, they become immune, at least in the short term. Transmission therefore falls, and eventually the disease stops spreading. This is known as herd immunity. The level of immunity across the population needed to stop the virus spreading isn't precisely known. It's thought to be between 60% and 80%. We're currently nowhere near that, meaning billions around the world will need to be vaccinated to stop the virus spreading. We'll probably see a decline in COVID-19 cases perhaps as early as spring 2021. However, lockdowns and other measures will still be needed to limit transmission while vaccination builds up population immunity. But if the vaccine only prevents infected individuals from becoming seriously ill, we will be left relying on infections to build up herd immunity. In this scenario, vaccinating the vulnerable would reduce the death rate, but serious illness and long COVID affecting younger people would likely persist. Mask wearing might become a social habit globally when somebody is not feeling well or is concerned for their health. Finally, fully eradicating the virus will be very difficult and will require a global effort. While we've got close to eradicating polio, smallpox remains the only human disease we've fully stamped out, and this took almost 200 years. Some vaccines, like measles, give nearly lifelong protection, whereas others need to be repeated, like tetanus. If COVID-19 mutates regularly and significantly, and its potential to do so has just been demonstrated, we may need to take new vaccines periodically, like we do for the flu. In the long term, we would also need to vaccinate children to maintain herd immunity. The social and economic effects of the pandemic will probably be long-lasting too. Perhaps life will never return to what it was before. But it is up to us to make it safer by being better prepared for future pandemics. This channel is made to help you know your body better. Don't forget to subscribe and turn on notifications so you won't miss any videos in the future about your body.